Good afternoon, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And I'm so pleased now to have Mr. Christopher Ross here in the studio. He is CIO of the Mayo Clinic. Hello there, how are you?
Hi Mabel, it's nice to be here.
Great to see you. Well, I wanted to get a feel for what your takeaways were for the panel that you had earlier today, and also other things that you've been talking about in terms of the Mayo Clinic.
Sure, well we had a great session earlier today here at the conference around interoperability. And along the panel was two HIE participants and myself. And you know, this is a really interesting and important time in interoperability, with ONC issuing the interoperability roadmap, with the Meaningful Use 3 proposed rules coming out on Friday. A lot of efforts around things like how is the new standards going to be developed around this set of fire technologies that's being pushed forward by HL7. There's just a lot of things going on right now, a lot of it pretty technical, but at the base of it is how do we meet patient needs better.
Okay, and in terms of meeting patients' needs, how will life change for them once the Mayo Clinic and some of these other standard-setting organizations get all of this in place? What is life going to be like for the customer?
That's a great question. So at Mayo, we really believe and act that the needs of the patient come first. So when we have patients who receive a lot of their care from us, or maybe they just come to us for an episode of care, whatever that is, they really expect that their care team's going to know everything about them. And if they don't know everything about them, that they can find out. So when we have patients come to us from all 50 states or 150 plus countries around the world, we need to do a great job, not just a good job, of understanding who they are in context, making sure that we can make their time at one of our destination medical centers fairly brief and purposeful, they get the care they want, and most important, that the information that they get from their Mayo physician returns back to wherever they receive care with their local physician. So that's a big part of what we're trying to do to meet patients' needs, but we also have a huge agenda around research and education as an academic medical center. And as our CEO, Dr. Noseworthy, has talked about, our mission is really knowledge to delivery. How do we not just treat people well within the walls of our facilities, but how do we digitize our knowledge and provide it out to other places to provide great care beyond Mayo's wall? So for us to be able to move information about patients and knowledge about leading techniques for healthcare is really central to our mission.
Well, we have certainly seen a timeline being set out by, this is the 5th year that the ACA has been in effect. So what has happened at the Mayo Clinic in the last 5 years that has accelerated your move towards making more data more readily available?
Sure. So part of the Affordable Care Act came with the predecessor to it, the High-Tech Act, that was part of the stimulus bill that preceded it, obviously. And that's what jump-started the investment in electronic health record systems around the U.S. And you've seen the data about the rate of adoption, and we're an industry that's gone from largely paper to largely digitized in about 5 years. And that's pretty remarkable. That's faster than retail, that's faster than banking, and so on. So we've had a lot of bumps along the way, but a lot of progress. You know, we continue to be focused on trying to meet our patients' needs as carefully as we possibly can, regardless of the change in reimbursement models and so on. But we know that the change from paying for service to payment for value is on us and is going to continue to accelerate and grow. So for us to be able to manage whole episodes of care or whole lifetime of care, if appropriate, is really important to us.
What's the next stage, do you think?
The stage of what? Do you have
in terms of just, we have now, we know that the change is here to stay, and we're looking at more of a retail environment, more consumerism. What do you think the next stage will look like?
Yeah, thanks. So some of the things that we're preparing for is, number one, we need to have a lot better analytics around populations and around cohorts. So a population would say, you know, there's many patients who are treated by Mayo Clinic in our Mayo Clinic health system, which is a large system of local hospitals and clinics across Minnesota, Wisconsin, and Iowa. And so in that way, we look like a lot of large, sort of diversified health systems. And for them, many people come to Mayo Clinic for a big chunk of their care. So we want to understand the chronic disease requirements. We want to understand emerging kinds of issues. We want to understand how to intervene with a patient group when they might be lagging behind, say diabetics who aren't compliant with using their meds or getting their regular checkups. We also want to look at cohorts, which would be a slice of patients who all face maybe similar kinds of diseases or maybe a set of comorbidity that require treatment in some particular way. So whereas Mayo has done lots and lots of research over 150 years around advancing specific treatments, Mayo has also been a leading place of integrated care where teams work together. And we're really seeing a lot more premium on how can we get the data to work together to support our teams working together.
Okay, well, we look forward to hearing more about that when we see you next time. Yes, thank you so much for your time today.
Thank you, Mabel. It was a pleasure.
And I've been speaking with Christopher Ross of the Mayo Clinic. I'm Mabel Zhang. Thanks for watching.